Hi, I'm Rosina Badal Munir, and today we will learn about the focused cardiac ultrasound in COVID-19 patients. Evaluation of the heart is achieved with some basic views such as a parasternal long axis view and parasternal short axis view, and the apical four chamber view and the subcostal view, and we also use the subcostal view to look for the inferior vena cava for the volume status of the patient. The focused cardiac exam is very important to evaluate the confirmed or the suspected cases of the COVID-19 for any underlying cardiac dysfunctions. And the emergency physicians can remember the cardiac exam protocol by remembering the 5 E's, that is the entrance, the exit, the ejection fraction, the quality, and the effusion. So just remembering these 5 first protocol steps for 5 E's, they can perform the entire or complete focused cardiac exam for the better evaluation of their patient. Evaluation of IVC is a very common practice in the ICU to assess the patient volume status. Now, in order to look for the IVC, so place the transducer in the midline in the upper abdomen just below the xiphoid in the longitudinal plane. Remember that the pointer should be facing towards the patient head, and just tilt a little bit towards the patient right, and when you will see the liver, and you will see just below the liver you will see the IVC which is entering into the right atrium. So put your probe and tilt it a little bit towards the patient right. So this is through this window you can see the IVC and the liver and the right atrium. The IVC collapsibility and the respiratory variation will give you an idea or the estimate of the central venous pressure, and also the estimation of the patient fluid responsiveness. So now if you see that if the collapsibility is 50% in a spontaneously breathing person, so this is normal. But if you notice that the patient IVC is the diameter is greater than 2 centimeters and it is not collapsing, and the collapsibility is less than 50%, so this gives you an estimate that the patient has a higher central venous pressure. So this is a table which shows you the estimate of the central venous pressure. So giving the fluids in the patient in which the IVC is very much dilated with the loss of 50% of collapsibility, so fluid will not be a good idea to give to those patients. But in the cases where you see that the that the IVC is less than 2 centimeters in diameter, and it is collapsing more than 50% in such a way that it is touching each other, and it is also the diameter is also very less. So this indicates that the patient is hypovolemic, and you can give the patient the fluids. So if you look at over here in this video, so this is the IVC and this is the right atrium, this is the liver. So note the collapsibility with the respiration. Look at over here how the walls are moving, and the collapsibility is like 50%. It is not very much dilated, and it is not very much small. And note the entrance into the right atrium. So now we will talk about the exit, which is the left ventricular outflow tract. And for that we will place the transducer on the patient chest at the left sternal border. Put the transducer in a transverse view, in a transverse plane, and with your pointer indicating towards the patient right shoulder. So place the transducer in the left sternal border in the left third to fourth intercostal space, with the indicator towards the patient right shoulder. Adjust the depth of your screen on the monitor so that you can see the view of the heart, where you can see the left ventricle with the outflow tract. So adjust when you are at this position, so you can just adjust your probe direction But the basic direction is this, that you keep it in the second to third intercostal space, or third to fourth intercostal space, depending upon the patient body habitus. So you in the parasternal long axis view, you will see the heart in this view. So you will see this is the left ventricle, and you will see the left ventricle moving towards the aorta. So this is the main appearance which you will see in the parasternal long axis view. So let's talk about this image which we see on the monitor. So if you look at over here, the bright line over here is the pericardium, and this is the left ventricle inferior wall. So above that you will see this black area, hypoanechoic area, because everything which is fluid that looks anechoic on the ultrasound, just for your recall. So this anechoic cavity is the left atrium, and then this one, these are the two moving structures which are the mitral valve. They open into the left ventricle, so left atrium and opening into the left ventricle, and the left ventricle will look like a more like a oval, the lobulated structure, and which is moving, which will open into the aorta. So these hyperechoic structures are the moving structures, are the aortic valves, and here is the aortic root. Above the left ventricle, you will see this another linear long structure, a valve type structure, and this is the interventricular septum. Above the interventricular septum, close to your chest, the patient chest, is the right ventricle. So now if you look at this whole image, so just this one parasternal long axis view will give you a lot of information about the patient heart. You can see the wall thickness, you can see the movement of the valves, you can see the interventricular septum, and you can have an idea about the estimate of the patient left ventricle, because the right ventricle is smaller than the left ventricle. So this just one view gives you a lot of information. Plus you also look that there is no free fluid or no pericardial effusion in this patient, around this heart. One more structure in this image is this is the descending aorta, which is not very clear in this image, but you will see another anechoic structure, the rounded structure, which is the descending aorta. So this is the parasternal long axis view, where you can have the assessment of the left ventricle and right ventricle size, and the movement of the both the ventricles, in systole and in diastole. You will look at the exit root, which is the exit area, which is the aortic root. You can look at the diameter, look at the mitral valves, like the mitral valve and aortic valve are very clearly seen in this view. Look at the interventricular septum and any wall motions or wall abnormalities, and also the pericardial effusion. So this is the parasternal long axis video of the heart. So you can see the left ventricle. Note the movement of both the ventricles, the right ventricle and the left ventricle. Also note the mitral valve and the aortic valve, and the mitral valve touching the interventricular septum. So this gives you the normal qualitative assessment of the left ventricular ejection fraction. Now we will talk about the parasternal short axis view. So when your hand was in the parasternal long axis view, so keeping the probe at the same position, but now you move your probe a little bit towards the anti-clockwise direction, so that now the indicator is pointing towards the patient right hip. So by doing that, you will get the short axis view of the left ventricle. So if you look at over here, you will get structure when you move your probe like that, with the indicator pointing towards the patient right hip. So you will get a structure where you can get the transverse or the short axis view of the left ventricle. Now this is the view at the mitral valve. So you look over here. So this is the left ventricle, and these are the leaflets of the mitral valve. Over here you can see the very nicely the movement of the mitral valves. Look at the concentric circle of the left ventricle, and this is the interventricular septum. Above the interventricular septum, you will see this crescent shape right ventricle. So this image, which is the short axis parasternal short axis view, gives you the information about the mitral valve, about the shape of the left ventricle also, and the right ventricle. So here is the video clip of the short axis view. So look at the mitral valves over here. Look at the entire left ventricle movement and the ejection fraction and any abnormality in the surrounding region. Now, keeping your hand in the same view, in the same plane, if you move your probe a little bit more towards the patient head, so you can see the mitral valve at the papillary level, and also the short axis view at the level of the aorta. So when you move your probe a little bit in the same plane where the pointer is indicator is pointing toward the patient right hip, you will see the transverse or the short axis view of the at the aortic level. So in this view you get a lot of information about the many of the structures by looking at many structures. So when you move your probe a little bit towards the patient head, so that you can see this nice beautiful Mercedes sign type of structure of the aorta, where you see these three leaflets of the aortic valve. So in this view you see over here the lower structure is the left atrium, above that is the right atrium. You will see in the video, you will see more clearly. So in between the right atrium and the right ventricle, you will see the the tricuspid valves, and the left ventricle you will see right above this Mercedes sign of the aorta, and above that you will see this the right ventricle, and then you will see the pulmonary valves and the pulmonary artery. So this is the right ventricular outflow tract. So in this short axis view taken at the parasternal short axis view of the heart, you get a lot of information about the right ventricle, right atrium, about the aortic roots, and also the pulmonary valves. So look at over here. Now in video you can see much better the tricuspid valve and the pulmonary valve. And over here you can see the aortic valves, the right and left aortic cusp, and the non-coronary cusp over here. So look at the size of the right atrium, left atrium, and the right ventricular, and also at the outflow tract. Now we were left with the apical four-chamber view and the subcostal view, and both these views windows help you to view the four-chamber views of the heart, and where you can see the equality of the left ventricle and the right ventricle sizes. So for the apical four-chamber view, so this is the apical four-chamber view, you put your probe in a transverse plane with your indicator pointing towards the patient right, and keep it just inferior and medial to the left nipple, and adjust your probe so that you can see the four chambers of the heart. Sometimes it is also helpful if you turn the patient towards the left lateral decubitus position with the left arm above the head. So this also helps brings the heart a little bit closer towards the chest, and you can see the nicely see the heart. Another is the subcostal view for looking for the four chambers of the heart. So you put the probe in the subxiphoid region, this region. This is the same plane where you look for the IVC, but that at that time your probe was in a longitudinal plane. But for looking for the 4-chamber view of the heart through the subcostal window or the subxiphoid window, you keep the probe in a transverse direction in such a way that your indicator is pointing towards the patient right shoulder, and then look through the like your beam should go towards the patient left shoulder. So look through this and you will see a nice view of the 4 chambers of the heart. In a subcostal view, you will also see some portion of the liver also. So in this view, you can see the area of the heart which is close to the liver. This is the right ventricle, this is the right atrium, and further away, this is the interventricular septum, and away from the liver is the left ventricle and the left atrium. So now by this view, both by using either the by using the apical window or by the subcostal window, you look at all the chambers, 4 chambers of the heart. Look at the size of the heart, look at the size of the ventricles. So the right ventricle is smaller than the left ventricle. Look at the wall motion and look at the sizes of the right atrium. So this is the 4-chamber views by the apical and the subcostal window. So this is the 4 chambers of the heart, and you can see the right and left atriums, and you see the right and left ventricles. Look at the wall interventricular septum. Look at the apex of the right and left ventricles. So lastly is the effusion. So if you look at over here, this is the parasternal long axis view. This is the 4-chamber view, and this is the parasternal short axis view at the aortic valve level. So in all these views, you can very easily look for the effusion. Effusion, you know that it looks black because it's the fluid, so it will look black just like this, anechoic. And so in all these cases, you can in all these windows and using all these planes, you can very easily evaluate, you can very easily look for the presence of any pericardial effusion. Hopefully now by using the SONON 300C, you can scan your patient for the focused cardiac ultrasound. Thank you for your time and attention.